Hello. I think time is there. It's already 8 o'clock, and we should start beginning of our session on statistics, epidemiology, and the research method. So before I proceed, let me understand about the participant. Uh, Dr. Yoga Satya, can you uh, introduce yourself?
Sir, good evening, sir. This is Dr. Yoga Satya, anesthetist from Tanjavur, Madurai, sir. Tanjavur, Tamil Nadu, sir.
So what is your expectation
I just want to
on
know
the
and
yeah? Mm.
I just want to know about the research papers and methodology like that, sir. As I am an
Okay.
assistant professor, I want to teach my students also.
Yeah, so we'll be sharing the PPT also
Okay,
so
sir.
that it will be easier for you to teach. And
Okay,
we'll
sir.
also teach you the use of analysis software, WHO software AP info. So it will be useful for that. So
Okay, sir.
next person, Venkatesh, can you introduce yourself? Venkatesh
Hi.
Keshwan. Yeah,
Yeah,
yeah.
hi, good evening. I'm Dr.
Good evening.
Venkatesh. I'm a neuroanesthetist. Basically, I'm from Bangalore. Now, at
Yeah,
present, I'm in Muscat. I've been working with the research methodology and training students for the last almost 30 years now. I
yeah,
still feel there'll be some lacunae or some fine tuning of my knowledge in evaluating the scientific papers, which I keep getting very frequently. So
yeah.
some
So,
fine tuning is required because sometimes we fall short basically in the
yeah,
statistical issues.
yeah,
And now that lot of new things have happened in the analysis of this data, and the data
yeah,
is becoming much more and more complex when it comes
yeah,
to research and outcome studies.
yeah.
So I thought this will be something which will be useful for me
And
in
at the same
coming
time,
years.
yeah, at the same time, advanced software also are helping us when to resolve the complexity. Are you using AP Info software for analysis?
Right now, I'm not actually doing any sort of analysis. I mean, the statistical analysis because I leave it to the professionals and the people who are doing it all the time. So I just give them my requirements and my uh, objectives. So based on
Mm-hmm.
that, they give me the report. So now I thought I'm basic understanding I have, but some complex things I think I need to update myself, which it is not possible just reading the books. It's only happens through interactions.
What's your age?
61.
Yeah, it's equivalent to me, but still, AP Info such a easy software. You will love to do it yourself. It's very easy. So I
Okay.
think that will be helping. So the next person, Dr. Tarun, can you introduce yourself? Dr. Tarun? Okay, till then, Nikhar. Nikhar, can you introduce yourself?
Hello, I'm Nikhar. I'm a MBBS student and I want to learn this course because I want to know how I can apply it in my further studies.
Are you the daughter of my student, Dr. Jayul Kamdar?
Yes, sir.
Yeah, I'm very glad to just convey my regards to Jayul, right? Good that you have at this age. Uh, then next, Santini, can you introduce yourself?
Good evening, everyone. Am
Good evening.
I being heard, sir?
Yeah, please.
Yes, sir. I'm an anesthetist working in ESIC, and presently I'm in Kerala ESIC. I have done two papers, but all with the help of statisticians, and I have not done any of the analysis myself. So I'm actually looking to have a very engaging session
So
in these 2 months.
your voice is not so clear. So it's with an echo, right? So, but so
Okay.
yeah.
So do
And
I have
you can introduce yourself in the group, so it will be easy to grasp, right? And in fact, I request everybody to introduce yourself in the group, so each one can. And that is when you uh, share in the group, that should be little bit in detail, so that, for example, so many anesthetists in the group, then we can think of that multicentric study. Uh, what about Priya Gayatri? Can you introduce yourself, Priya Gayatri?
Hello, sir.
Yeah.
I'm Dr. Priya Gayatri, sir. I'm a senior resident working in Sri Ramachandra Medical University.
Hmm. So SRM University in short,
Sorry, sir?
it is SRM University.
No, sir. It is Sri Ramachandra Medical University, sir.
Achha, Medical University. Where it is located?
In Chennai only, sir.
In Chennai only.
Yeah.
Okay. And who's the other person? Jeba? Jeba, can you introduce yourself? Because name is not written, so whatever is what I can read, that I'm just talking about. Anyone who would like to introduce? Okay, you can do later on also. Let me introduce myself also. I started learning statistics in 1978 during my first MBBS. At Baroda Medical College, they used to teach us in 1978 in first MBA itself. These are standard deviation, standard of mean, and standard of difference in two mean, etc. And at that time, we found it very difficult. But when I did my postgraduate at Surat Medical College, Government Medical College, we were given one very good textbook, and that is known as textbook by A.B. Hill. And that short textbook of statistics by A.B. Hill, that was so nice that I uh, I really started enjoying the statistics, just like you are taking ice cream or like that. So the purpose of this session is basically to make statistics very interesting and attach it with epidemiology and research, so that we would love to learn more and more about it. And there's nothing like burden in that. So the statistics, epidemiology, everything is very simple, provided we start for simplicity to the complex thing. Base remains the same, whether you go for the advanced statistics or basic statistics. If we do with understanding, it is interesting. If we just do on only a p value and etc., then it is very difficult. So I will start with my basic PPT, and all the material will be shared with you. And I don't claim at this age that I'm most advanced person in statistics, but at least I do understand that basics I'm very clear, because there's a 24th batch in which integrated way I'm teaching the statistics, epidemiology, and research method, so that the moment you finish the course of this 12 sessions on the 16th November, you should be able to teach it. Yeah, please. You want to share something, Vijesh? Okay. So basically, on 16th November, you should be able to teach basic statistics to your colleagues or medical students or someone else. And also do a basic analysis yourself rather than assigning someone. You need to assign someone, but at least how to calculate the sample size or how to do the basic analysis. You can do it, even say uh, there is a multivariate analysis also, it is possible for you to simple way, right? And for the clinician who are, let's say, anesthetists or like that, For them, the non-parametric test, where you have a sample size very small, like 5 or 10 or 18 sample. In small sample also, you can go for non-parametric test, and then you can have some kind of conclusion. So that's why we'll be covering those things. And when we give you some material, if you because it's only twice a week, you will find in between 3 days, 4 days. So if you go through that, the PPTs and learning material, then the dialogue and discussion will be more helpful in this. And from each batch, I also try to learn more and more things. So let me share my introductory slide. Uh, I will have I will have session 1, 2, 3, 4 up to 30. And so whether it is in a population or whether it is in the community or in your hospital or even in the classroom, wherever you want to apply epidemiology, you will be able to do it. But for that, you should be ready to define your population. In how much population you would like to apply this epidemiology. Once that is clear, the next thing would be whether you want to take a whole population or a part of the population. There is a sample that you can decide, and you can apply the appropriate statistical method. Based on it, there you can publish your research paper. This is a very simple thing. Now, the when you learn this, my request is that continue to enjoy the life. There is nothing heavy in this kind of learning. Is basically you can also say how we can enjoy life more. That can also be a one of the statistical analysis you can do is enjoying more, something like that. Or you can differentiate between success and the fruitful life, something like that. Other thing would be learn how to build an opinion together or as an individual and give it to others. Initially, what used to happen, the research paper was done by 1 or 2 person like this. Now it's a question of multi-centric research study, team of work, team of members at each center. So if you want to write or if you want to emphasize something before you start your research study, uh, you will definitely define the topic. But when you define the topic, also define your team members. And team members should include not only your center, but rest of the world also. That will help a lot. Of course, there could be some dilution in the research method and the data collection, etc. But because you have a comparison available with the rest of the world, the uh, the the importance of the research increases like anything. Because doing at one place may have other variables affecting, but you never know it. Third thing is, if you want to find a better job or better business, if you want to do it, this knowledge will help you. And last but not the least, it will help in realizing the truth. Now, basically, it's a game of judgment initially, and then you verify. So, what I say that particularly youngsters, the resident doctors, or like that, you try to initially judge something. I start with a simple thing. Your patient coming to you, and before you weigh the patient, just say that this patient is likely to have 60 kg weight, this patient 70 kg, this one 80 kg like this. So before you take a weight, try to judge how much weight it would be, and then take a weight. And then suppose you have found that it is a 60 kg, but your assumption was 65 kg. Then you train your brain, if this is the thing, it is not 65, it is 60 kg. Similarly, in terms of the height, in terms of the pulse, in terms of the blood pressure, in terms of the, for example, eyeball pressure, there is a glaucoma, so many things. If you try to do it 100 times, probably sometimes if the instrument is wrong, you will be able to find out that the instrument could be wrong. So that is the game of judgment. So try to measure it, apply the test, and reconcile that if this is the next case, this should be the thing. So rejudge and refine your judgment. This is very good for beginners, particularly the UG student. I don't say that you should not measure every time. But then, in case of emergency, this game of judgment, when you play amongst yourself, this will be very useful. Now, when we have so large amount of the database, people are using machine learning and artificial intelligence, etc. But in this case, your basic understanding, your artificial intelligence is not going to change your natural intelligence. Rather, we should be afraid that if we do not use our certain faculties of our brain, there is likelihood that there could be a degeneration. For example, when we didn't have the mobile phones, we used to remember telephone numbers of at least 30, 40 people. Now, today, if you say, hardly we remember our own phone number, other no, at the most two or three phone numbers. So that means the faculty of our brain, which used to remember so much things, may not use that cells. But then the AI, machine learning, everything will help us in reducing our time in analysis, etc. And that time should be utilized for the purpose of meditation and the attainment of something which is intangible. That time should be allocated for that. Right. Now the third thing is image processing, for example. Now there is a something like I read your diagnosis. You take an image or you take an image of the skin and try to find out the diagnosis, etc. So this is also becoming very popular, and common people are also using for the diagnosis purpose, whether it is right or wrong. When we have a large database, we'll come to know about it. Fourth is a non-invasive versus invasive test. Now, why statistics is one you want to apply over here? Because your non-invasive test of, let's say, hemoglobin, it says a 13 gram, and invasive method says it is 13.5 gram. So you have a large database. At that time, you need to find out concordance between these two database, and you validate whether non-invasive test is proper or not. For example, we have found a test for vitamin A deficiency detection without taking blood. So when we compare with the blood test, we'll come to know that how far this is true. Then someone talked about this complexities is increasing because there are so many even food groups. Initially, uh, we had a very few food groups in eating, maybe 100 or 200 items, but now it's in lakhs of the things. So if you take a food or if you take an environment, there were, let's say, around 50, 100 chemicals to look out in the environment. Now we have thousands of chemicals in the environment to look after as a causative factors. So complexity is increasing. And to face this challenge, we developed the concept human concept. H stands for homeopathy, U stands for universal healing, Unani and all other systems like Reiki, Sujok, etc. N stands for modern medicine, in which I did my MD in community medicine. A stands for Ayurveda and N stands for nature cure. So since 1991, we are doing systematic efforts to combine all the pathies and apply in day-to-day life. And there's a lot of success with this. And last but not the least, purpose of life. I request all the participants to make clear what is the purpose of your life and try to integrate that purpose with this kind of the learning process. Then you'll be benefit much better. Now the perspective changes. let's say when I say today is day, and you will say no, today is night, and we fight for that. But then I may be right in context of some other place. So whenever there is a quarrel between two persons, we should try to understand Shyadvad of Jainism, and that's the opposite person may be true. And when you apply the statistical data analysis and try to interpret, at that time some progress will be there to decide whether to do this or that. Because what happens that usually professors, old age professors, 65 or 70 years say, as per my experience, this medicine is better than that. But that experience to validate the youngster can go for the data analysis and it can be proved or disproved. Then the we should look at the intention also. Nowadays, so many research papers are written only for the purpose of getting pass in exam or getting promotion or getting name and fame. So the intention behind the research should be very clear. If you want to be happy in life, if you keep your intention clear in doing research, then you will be really happy. Otherwise, you just spend 5,000, 10,000, 15,000 rupees ready-made research are available in the market and then go increasing your research paper. That is not the true thing. And the bias and artifact are very, very notorious things. And that is the purpose of teaching you the statistics, particularly the AP info software. I will tell you a story that one physician came to me that, see, I have found out the how to find about the glycosylated hemoglobin in the blood just based on urinary creatinine level. Urinary creatinine is very easy. But then when I did the analysis with AP info, we could find that the age was a confounding factor. Because of age, urinary creatinine was increasing. Because of age, the glycosylated hemoglobin was increasing. So when we remove the effect of age on both the factors, there was no correlation between urinary creatinine and glycosylated hemoglobin. So this is, you should try to learn how to remove the effect of third factor and how to find out that the factor which affects both the input and output variable, so that you can get the clean result. And when we talk about the epidemiology, the concept and basic tools in epidemiology are very important. I say we must start with the population and then we should go for sampling. Whenever you want to talk about the population, you should be very clear. Say in Ahmedabad, I go to the 2, 3 schools and say the school children are spending around 30 to 35 rupees per day. So if I've taken this 3 or 4 schools in Ahmedabad, as per my choice, you can't apply to the whole Ahmedabad. I should have used an appropriate method. For example, in Ahmedabad, if there are 600 schools, I should take at least 10 to 15 schools, or if I can make the all the school children together, then I can go for cluster sampling. I can go for 40 schools, 6 children in school. In this 240 students, if I go for the analysis and then I can apply for the whole Ahmedabad. That is a possibility. So in epidemiology, always try to define your population first based on the topic which you want to study, and then go for sampling, subsampling, etc. So, uh, and the concept of random sampling. So most of the time when we talk to the resident doctors, how you have taken this sample? It says game them. In Gujarati we say game them. Just the way I like, I take. It's not a random. The word random, all of you can note down that each individual within the population has an equal chance of being selected. This is a very, very important way. You take a sample from the population, each individual within the population has an equal chance of being selected. And when I say the individual and I use the word population, it is not always that we talk about the people and then individual. It's a question of the data. If I take a height of 100 individuals, that height, 100 numbers written in terms of height, let's say 5 feet 6 inch, 5 feet 7 inch, 6 feet 2 inch. All these figures is my population in statistics. And when I choose 3 or 4 figures randomly from that, that is my sample. So each individual within the population has the equal chance of being selected. That means not only 100 individuals, but the 100 observation I have. From that 100 observation, I should have a method by which each individual within the population has an equal chance of being selected. This word random, the total population, define your topic. That is the basis of epidemiology. Rest of the things are very simple. And now, when you have a large data set or even a small data set, when you want to integrate with statistics and research, in statistics, you should be able to clear about the variable. And I divide the variable into two broad categories. One variable from which you can find out the mean, that is something which you are measuring, and other variable which you can find out proportion, but not the mean. So you should at least write down 5 variables from where you can find out means and 5 variables from where you cannot find out means. Now, once you can do this, very simple thing, but data analysis with AP info will be very easy. Just take it as your assignment. By the next before the session starts, you should be able to write 5 variables, which is a category variable or which is a descriptive variable or a variable where you can find a proportion like diabetic, non-diabetic, anemic, not anemic, tall, small, or let's say the white or black, pass, fail. These are the things from where you can find out the proportion. Or the measurement variable from where you can find out the mean. For example, the height, weight, hemoglobin level, blood cholesterol, blood glucose level, like this. So that based on that, we'll be using which AP info test we should be using. Other thing is concept of causality. Now, this is a initially to establish that we are usually doing descriptive epidemiology, time, place, and person. We describe the things. And once we say that, yes, this could be the one of the thing, then we move towards the case control study where we go back and ask the history for the exposure. And then if to verify it, we further do the cohort study and randomized control trial. And then also sometimes causality, we may not be able to do it. But if we do the large study at a various places, causality becomes a simple. But nowadays, causality is because of so many factors that uh, we may not be able to pinpoint that this is the cause. Or even if we have 30, 40 causes, how much proportion where? So for that purpose, we are going for attributable risk. I just take a 1 minute break. Uh, 1 minute break, just. Sorry for interruption. Just yesterday and today we are the transition phase of shifting one center to other center. Anyway, so one thing is the causality, and the next thing would be epidemic study design and bias. So in study design, we'll have the various the prospective and retrospective case control cohort and the cross sectional. So many things we'll have in that, and that should be clear when we are doing the research. Now there is sometimes confusion. The research design and epidemiological design. So, actually speaking, these words are so many, the difficult words, otherwise the meanings are very simple, right? So, there's nothing to worry about it. For example, when people say the p value, but p value, if you remember that p is the probability of occurring a इवेंट बाय चांस कितना परसेंटेज है कि ये ट्रू होगा समथिंग लाइक दैट दैट इफ यू आर क्लियर then there's something like standard distribution, no chart like that, no? And then normal distribution. When we use the word normal distribution, is not the word normal; it's a usual distribution. But from since years, we say the normal distribution. Normal distribution doesn't tell you what is normal. So it is usually distribution will get like that. So there are certain words which are used from years together, and that is a confusing a lot. This screening sensitive specificity, I will share my video on that. That will be sufficient to explain that, and we'll be talking about how to use this in field practice. Outbreak investigation is not the objective for most of you. So it will be someone from the community medicine will get that. Now, when we say the statistics, our basic the objective will be all of you should be using the Google form so that you can collect data very in a short time. So if you would try to write down in the chat that do you know how to use Google form, right? Yes or no, so that I can find out whether you are awake or not. Write down yes or no. Do you know how to use Google form? Because before you finish the last thing, the research paper, not the research paper, but the one research project is compulsory, and some data collection tool you should be using. If you don't know, just write no also, right? You can write no also, but write something. Only one person has written yes. Even if you don't know, you write no, so that I know that all are getting involved. Okay, let's say that people know about it. So next thing would be, so you will learn that. The thing is, the central tendency, meaning of that, when suppose you have, I ask another question. We have, let's say, population of 1,000, and we want to take a sample of 100. How many such samples will be able to take? I repeat, I'm using chat now because that will get your involvement. The thing is, the next question is, I write in the chat, how many of you, how many samples of 100, right? 100 is the size, can be taken from 1,000 population. Very simple question, quickly answer. How many samples you can draw? There is 1,000 population, you are taking sample of 100 individuals. How many such sample you can draw? Quickly write. Yes, very good, fast, very fast. Anyone else? Anyone else? You write something. Whether you write 0, do not know, 100, whatever you want to, but write something. Real answer is more than 1,000. Because when you say the 100, you replace one, put it back and take another one. So it's not 100, it's more than 1,000. You can take permutation, combination. So when you give an equal chance of being selected to all, the purpose of telling this that out of 1,000 population, 100 such the samples, you can take 1,000 samples. And when you take a mean of the means of the samples, I repeat, very, very important word. When you take a means of the sample, it is almost equivalent to the population mean. And that is the fundamental to understand when you want to talk about the population mean based on a sample mean. This you should remember this sampling technique, how the sample is taken, sampling error, and also the standard error. If I use another word, let me use another word when I say that sampling standard error is one type of standard deviation. Standard is one type of standard deviation. If I use this word, I'm true or not? Just tell me yes or no. Write this. Your marks will be given based on your participation. Come on. Either write yes or no. If you write yes, you will get 10 marks. If you write no, again you will going to get 10 marks. But if you don't write anything, you get 0 marks. Yes or no? No. Anyone? Yes? Yes? Anyone else? No. Anyone else? Both. Those who are writing no and yes, both are getting 10 marks. But those who are not writing anything are getting 0 marks. So let me tell you that the standard error of standard error is one kind of standard deviation, right? But how this is derived, that is very interesting, and we'll talk about that. And this will be very much interesting. If I tell you that we want to compare the hemoglobin of the one population with hemoglobin of other population, which statistical test we are going to use? Or if I say that based on the sample, I want to talk about the population, about the mean income or mean expenditure, or let's say about the blood sugar level like this. Which statistical test should be used? If I have three population, I want to compare around four variables, which statistical method I will be using. So there are so many the examples, but then should we not have a simple flow chart whereby we can say this is the test which should be utilized? So that diagnostic pathways we are going to use it so that you can also answer, yes, this is the thing. For example, if I want to find out the whether the sample the proportion of the diabetics in a sample and proportion of diabetics in the population, whether this population and this sample are similar or not, means sample is taken from this population or not. If I want to find out this, which method I'm going to use? Because in the case of proportion, I am going to use standard of proportion. So such things, if I have two variables, if I have one variable, if I have two population, I have three population, all this permutation combination we are going to have so that you know which test should be utilized. And now because we are not going to do it manually, in AP-Info, what is to be done? Which statistical test we should be using? That we'll be doing. Then the introduction to open API and statistical software, including web-based application. This is only for the youngster like Nikha. They can go for the use of this kind of software because they have a young brain and they long way to go. This data set you should be keeping ready. Whether you have an old data set or you want to generate new data set, but you should have a data set ready at least in Excel form, whereby all the headings are very simple, right? And there's nothing, the decoration is not required in this Excel file. You have a header like name, age, gender, etc., blood pressure, systolic blood pressure, diastolic, everything. You should at least 40-50 data with you. And because when we start with the AP info, you should be able to do the analysis. Today, I will be talking about the AP info software for a few minutes so that you download AP info software in your the computer, and next time you should be ready to use it. Now, the advanced statistical test for multivariate analysis will be giving small examples so that you get interest to do that. Uh, there are this is only for the statistician and advanced users, because let's say when I want to compare two countries, let's say the Pakistan and India, or to state like Rajasthan and the Gujarat. Then I want to within a Gujarat to district, within district, something like that. Go on comparing to families, etc. So there is a data set attached with the taluka, data set attached with the country or attached with the families. That should go directly into the individual. And that can happen provided you know the relational database, how to relate two files. Suppose I have 100 families and 500 individuals. So data of 100 individuals should get attached to that 500 individuals. Then the analysis becomes simple. This will be appreciated by the statistician who are doing the analysis. And that you should know that this will avoid unnecessarily taking a data repeatedly. For example, 5 family members are there. All 5 families, and you are not going to ask that whether you have electricity or not, whether your environment is good or not, whether your house is kacha or pakka. All these 100 variables which are attached to the family should get attached to the individuals automatically. And the parameters which are attached to that village in which family is residing, that village, the approach road to the bus stand, approach road to the railway station, whether the post office is there or not, whether Anganwadi is there or not, such data which is attached to that the village or area should get attached automatically to the family and automatic to the individual. This relational database is very important to avoid the duplication, the data entry, etc. And that should be the learned by not all the members, I would say, but those who want to work in the committee-based setting, they should know it. And each participant start thinking about your project in which you are going to work from day one. For example, you want to find out which anesthetic agent is having a less side effect and the more effectivity or more recovery rate, something like that. If you are, let's say, in the pharmacology, for example, which medicine is more useful. If you are the MBBS student, then you can think of which branch is more giving rewarding as per the personality of the individual. Such projects you can take. Or nowadays the burning is the lifestyle issues. uh, I would like to introduce that my wife, Dr. Hema Mehta, she is doing PhD in how to modify the lifestyle of the people by the spiritual understanding. She is doing PhD on that under International Hindu University. Format will be shared with all of you also. So try to find out local or global problems and then try to solve that problem. The research should be so that you should be able to have an answer to some question. Even if your research is so short duration, let's say 1 month, 2 months, 3 months, but it should be beneficial to the object or the subjects you have which you have included in your research. Now, see the or if you are right now or 7 participants, all of you should be asking me one question which I cannot answer. Then only my teaching is over, right? So that together we can find out the answer and we can grow together. So, uh, uh, the The career guidance for youngsters will be definitely there. And I will be giving you the nutrition software and WHO software for the analysis purpose, right? And the something which we are doing in People's Health and Development Trust and Human Health Circle will also be shared over a period of time, right? So I end over here, and at the end we are going to give a certificate after the 1 or 2 months of the is over, because somebody takes the time in submitting the project, etc. It's not the 16th November you will all of you will get certificates. It's not like that, right? So now the session is open for interaction, and then after 5-10 minutes interaction, last 5 minutes I'll be showing the AP info software. So any question? At least you can write. Yeah, please carry on.
You said standard error is one type of ST, standard deviation.
Yes,
When you
yes.
take the mean, it's you talk about standard error mean and standard deviation. Is it becomes the same or?
So it is very interesting to know about this. So I will tell you that suppose uh, you have taken you have taken 500 samples from population is only 1,000. Population only 1,000, but you have taken 500 samples, each sample having 100. Okay, so when you take the means of the sample, almost it will be equivalent to the population mean. I again repeat, if I take 500 samples from only 1,000 population, each sample having 100 individuals. If I take mean of all these 500 means, right? Because each sample will have mean. So I will have 500 means. If I take a mean of this 500 means, what will happen? It will be almost equivalent to the population mean. Am I correct?
Yeah.
Have you understood?
Yeah, got it.
So now, when I say that, when I plot a diagram, of all the means of 500 means, and I will draw the normal, normal curve or standard normal curve. So what will happen in this thing? There will be the means of the samples, and those means will vary one standard deviation, two standard deviation away. That will be that. And that standard deviation we call as a standard error of mean. That is why standard error of mean is nothing but a standard deviation. But standard deviation of what? Means of samples around the mean of the means of the samples. So that is the standard deviation of that. So I will take that in detail so that you can understand. Yes, standard deviation. There could be a standard error of mean, standard error of proportion, standard of difference between two means, standard of difference in two proportion. All kind of these four standard errors are there, but all they are basically a standard deviations. But of what? Of the populations from where these samples were taken. So these samples, their means, their proportions, they are drawn, right, in terms of standard curve. But the thing is, the beauty of statistics lies in that we actually need not go that far, and based on a single sample mean, we can find out the population mean. That is the beauty of this statistics. And that's why we are using the word standard error. Actual word is sampling error. But when you standardize sampling error, this is known as standard error. When you standardize sampling error, it is known as standard error. Whenever you want to talk about the population based on a sample, there is some error that is known as sampling error. So we'll come down that and you will understand why this same standard error is nothing but a standard deviation. Right? So any other question?
Thank you. Yeah, you also said about
Yeah.
There are two types of variables, one which variables which mean and one with variables with proportions, right?
Yes.
You mean to say that some variables only mean can be calculated out of that, and some variables only you can have proportions out of that.
Yes. For example, I take a blood sugar. Usually, you won't be able to take a proportion. Of course,
Yeah.
when you say the high blood sugar, low blood sugar, you can find out the proportion, right? But when I say the blood sugar, you'll be able to find out the mean of the blood sugars. This is because when you want to go to for the analysis in AP4, you are going to use the command means, and for proportion, you are going to use the command tables. Very simple thing. So if I tell you that mild anemia, moderate anemia, severe anemia, if that is categorized based on the hemoglobin level, then which kind of this variable? So it can be used as a proportion also. It can be used as a to find out the mean also. But I don't want to go into that kind of complication right now. Let's go for simplicity. You use the table command for proportion, you use the means command for the means. Simple, right?
Okay.
Any other question? So you can keep asking me question. Meanwhile, I will show you the AP Info software, which will be very easy to use and very simple also. And you will have something like AP Info 7. And I launch every Info 7. You'll have 6 screen. Out of that, we'll be talking about this classic. The rest of you can 1, 2, 3, 4. This you can use it. The maths, I usually don't use it, and it requires a lot of the layers. And my colleague is there. If someone want to use about QGIS, etc., that you can use this. Otherwise, this I frequently use it. I usually don't use this, right? For sample size, we are using this. But today, our data analysis requires this. Now, screen is visible to you. In this, if you are using mobile, it will be difficult for you to understand. But try to use a laptop or desktop next time. This is the first command which you are going to use is a read command in the AP info. And you can use the Excel file also that we'll learn in third or fourth session. But right now we are going to use AP info files itself.
Just want to ask you, this EpiInfo is a free software or it is part of the
It is a free
What?
software prepared by the WHO. I'm using AP info since 1989. And that was taught by my friend Dr. Sridhar in while we were working were going to the train. He gave me a small 3 or 4 papers manual. Since 1989, I use this AP Info software. Of course, there are a lot of advances in 1989 now, today's, but this is just to tell you that, and the advantage is very simple to use, and the is free software available because of by the WHO. So I selected one file having a 75 the individuals, and you can see the data by using the command list. So this is the database. 75% are there. You can see like this, right? Male, female, etc. And now I'm showing the top name, age, sex, what they've taken. There's a party of 75 individuals. They took something, spine, somebody took ice cream and etc., chocolate, all those things. And few people fell ill, few people remain healthy. Why so? What was the cause? That analysis can be done by this. And very interesting that you can use this tables command like this. Exposure variable is, let's say, chocolate versus illness. Illness, right? So interesting that it says that illness was there in 45 individuals, 29 no illness. We want to find out why few people felt sick, why not. And when we compared with the chocolate, 53% were taking if you look at this, 55% were taking column percentage. Those among ill, they 55% were taking chocolate, not ill, 75% were taking chocolate. So it seems to be a little bit protective value, right? It's a chocolate and not a causative value. But when we say the analysis over here, and if you look at the p-value, it's 0.07. So we can say that it's just on the borderline, but we can say statistically it is not significant. It's not less than 0.05. But it looks there is some protective value of the chocolate. So we go for the next thing, tables command again. We can go for, let's say, rows taken versus illness. So quick and so simple. So those who have taken rows, 56% out of 37, 56% were ill and not taken 65%. So there could be little bit some reason behind, but not statistics. You can see the p-value 0.4 is not less than 0.05. So now some of you might like you might like vanilla. And let's see what happens with the vanilla. Go to the vanilla and then let's see, compare the illness. You can see the size of the red color size and the green color size, etc. Can you read how many took a vanilla? 54. Can you see this figure? Can you read this 54 figure? One of you can say yes or no. This 54 took vanilla.
Yes, sir.
And
Yes,
21
sir.
have not taken vanilla, right? Out of 54, 79%, 43 became sick. And out of 21, only 3, only 14%. 14%, but still 79%. There's too much a difference. And look at the statistical analysis. P value is less than 0.0000. So less than 0.05. Is this event less likely to occur by chance? And there's a significant correlation between taking vanilla and there's illness. But we'll try to remove we'll try to remove compounding variables by using the logistic regression, which will be this. I'm just showing the demo, but all of you are going to learn this thing. So there's a cabbage kaya. If somebody took jello, then somebody took vanilla. So multiple variables you're taking together to find out the effect of each one. Because how much a contribution by what in causing the illness. So it's so interesting, so delicious to do this analysis that today you are going to get a very good sleep, right? So look at this analysis, quick analysis. How much contribution by each one, and you can look at the p-value also. See the odds ratio. Odds ratio is not equivalent to the risk ratio, but then anyway, it's 24. The person who was going to take vanilla are more likely to get illness, 24, right? While the milk or other things less than the cabbage, only 1.1, others the cakes 1.9, like this, right? But only most important thing was the vanilla, which is more likely to cause and look at the p-value. P-value less than 0.05 is more likely to that this is a significantly affected with that. So with this example, I stop here and we'll be going next Friday. But before that, if you have any quick question, I can take it. Do share your concern, your assignment, or topic which you want to take, your introduction. Try to use this group as if your friends are there in the group, very, very the freely, but don't abuse each other. That is very important. No political news, etc. Right? So, any quick question? So, I end here and uh, await for your so many questions. The group was. Thank you all.
Thank you, sir.
Thank you, sir.
പിണറായി മാറ്റി പ്രത്യേകിച്ച്